Excessive bleeding after delivery is one of the leading causes of maternal mortality and morbidity. In medical terms, this is known as postpartum hemorrhage. It is said that there is one maternal death every 4 minutes because of this condition. Hello, I am Dr. Geetika Arora from Faculty of Medicine and Health Sciences. Today we will be discussing about postpartum hemorrhage and its management. All the postgraduate students should know what exactly postpartum hemorrhage is and what are the risk factors and causes associated with it. So postpartum hemorrhage is an obstetric emergency. How do we define postpartum hemorrhage? Postpartum hemorrhage means blood loss in excess of 500 ml following a vaginal delivery or more than 1 liter in a cesarean section. There are other definitions also for postpartum hemorrhage. Fall in hematocrit by 10% or more than 10% in 2 samples taken before and after delivery accounts for postpartum hemorrhage.
Ma'am, is it only the amount of bleeding that matters?
Very good question, Richa. It's not always the amount of bleeding because sometimes ladies, they have low reserve. So even slight amount of bleeding in them can make them unwell or hemodynamic unstable. So any amount of blood loss which makes a female hemodynamic unstable is termed as postpartum hemorrhage. Depending upon the time when the blood loss occurs, postpartum hemorrhage can be primary or secondary. Primary postpartum hemorrhage is the bleeding which occurs in the first 24 hours after birth of baby. Any bleeding after 24 hours up to 6 weeks postpartum is defined as secondary postpartum hemorrhage or late postpartum hemorrhage.
Ma'am, what are the chief causes of PPH?
Yes. So the causes of postpartum hemorrhage can be remembered as 4T. Here the first T stands for tone, and this is the most common cause of postpartum hemorrhage, accounting for 70% of the cases. Sometimes because of some factors like anemia, multiple pregnancy, polyhydramnios and macrosomic baby can lead to overdistension of the uterus, and the retraction and contraction of the uterus cannot take place that effectively. So the bleeding may continue. The second most common cause after tone is the trauma. After the birth of the baby, there can be trauma to the perineum in the form of vaginal lacerations. There can be cervical tears. There can be hematoma formation. So all these can lead to bleeding. Third T stands for the tissue. After delivering the placenta, we should make sure that all the cotyledons and membranes, they are present, because any missing part in the placenta can account for bleeding. So this is the third T, tissue. And the fourth T is thrombin. Prevention is always better than cure. Though postpartum hemorrhage can occur without risk factors, but still we have to remain very vigilant right from the antenatal period. So whenever a mother comes to us, we have to screen the mother for anemia by getting her hemoglobin test. We should also get blood grouping and other tests done. If the mother is found to be anemic, we can rectify anemia by giving tablets, infusion, or in rare cases, blood. We should also look for other risk factors like grand multiparity, multiple pregnancy, polyhydramnia, macrosomic baby. Thus, taking a proper and detailed history in the early antenatal period is very important.
Hi Amrita, I'm
Hello.
Dr. Geetika.
हेलो
क्या प्रॉब्लम है अमृता?
मैम पीरियड्स मिस हो गए
पीरियड्स मिस हो गए. कब आई थी लास्ट डेट?
10th of October.
फर्स्ट बेबी है आपका?
नहीं मैम सेकेंड.
फर्स्ट बेबी क्या है?
बेबी बॉय है मैम.
बॉय है. कितने साल का?
2 years.
नॉर्मल डिलीवरी थी?
हाँ जी मैम.
कोई कॉम्प्लिकेशन रही हो ड्यूरिंग प्रेगनेंसी या डिलीवरी के बाद?
नहीं मैम, नहीं, कुछ नहीं.
कोई ब्लीडिंग, एक्सेसिव ब्लीडिंग वगैरह
नहीं,
कुछ ऐसा नहीं था?
आपको वैसे कोई क्रॉनिक प्रॉब्लम हो, लंबे टाइम से कोई बीमारी?
हाँ जी मैम, थोड़ी थकावट रहती है, सीढ़ी चढ़ने पे थोड़ी सांस फूलती है।
ओके, किसी दवाई से एलर्जी?
नहीं मैम,
कभी ब्लड तो नहीं चढ़ा?
नहीं।
Active management of third stage of labor is the most important step in preventing postpartum hemorrhage. It is said that by following this, the blood loss after delivery can be decreased by as high as 60%. There are three main components of active management of third stage. The first component of active management is giving a uterotonic injection within 1 minute of birth of baby. The most common uterotonic used is oxytocin 10 international unit, which is given as an intramuscular injection. The second component is controlled cord traction. In this, one hand is placed over the suprapubic area and the other hand holds the cord. The suprapubic hand is taken in an upward and backward direction, whereas a steady traction is given on the hand which is holding the cord. Once the placenta is visible, the placenta is held with both the hands and it is rotated in a clockwise or anti-clockwise direction. Once the placenta with the membranes is out, we check that all the cotyledons and the membranes are complete and intact. This is to make sure that no cotyledon or membrane is inside the uterus, which can lead to postpartum hemorrhage. The third component after delivery of placenta is the uterine massage, which is done for 1 to 2 minutes. Despite following all the preventive measures, PPH can still occur. Here comes the role of multidisciplinary team approach to manage PPH. Speed is an essence.
मीना, तुम ठीक हो? तुम्हें कोई दिक्कत तो नहीं? तुम्हें थोड़ी ज़्यादा ब्लीडिंग हो रही है? मुझे अपने सीनियर को इन्फॉर्म करना होगा. गुड मॉर्निंग मैम. There is one patient, Meena, in labor room. She was delivered normal vaginally 3 hours back. She is excessively bleeding per vaginally. Kindly come and examine her.
Charlie, what happened?
Good morning, ma'am. Ma'am, this is Meena patient. She was vaginally delivered 3 hours back. Right now, she is excessively bleeding per vaginally.
I would like to examine the patient. Krishna, can you please give the position to the patient? Okay. Please start oxygen for the patient, 10 to 15 liters per minute. And Vaishali, may I know the vitals for the patient?
Ma'am, her BP is 90 by 50 mmHg. Her pulse rate is 110 beats per minute. Her respiratory rate is 17 beats per minute and saturation is 98%.
Okay, and the uterus is flabby, so it is atonic PPH. I need to catheterize the patient. Krishna, can you please give me the Foley's catheter? Okay, I will give bimanual compression to the uterus. Meanwhile, can you please secure 2 large bore IV lines? Please draw 20 milliliter of blood for grouping, cross-matching and coagulation.
Done, ma'am.
Okay, fine. And please call the hematology lab and the central lab that we need blood for the patient.
हेलो ब्लड बैंक. लेबर रूम में एक मरीज़ को ब्लड की ज़रूरत है.
The uterus is flabby. Can you please start the crystalloids for the patient on one side, and on other side I need the oxytocin drip, 40 units in 500 ml of RL to be started at the rate of 125 milliliter per hour.
Done, ma'am.
Okay. Vaishali, please check that the patient is not hypertensive. I need to give methotrexate to the patient.
Yes, ma'am. She's not hypertensive.
Okay, can you please give 0.2 milligram methotrexate slow intravenously? Okay, can I know the vitals again, please?
Yes, ma'am. Ma'am, her BP is 110 by 70 mmHg. Her pulse rate is 102 beats per minute.
Okay, fine. And but the uterus is flabby.
Krishna, can you please give carboprost?
And please know the time so that we can repeat it after 15 minutes.
No, ma'am, she's not.
Yeah, it's better, much better. Can I have misoprostol 1000 microgram? Krishna, can you please put it per rectal? Okay, great. Can I know the final vitals, Vaishali, please?
Ma'am, her BP is 120 by 60 mmHg. Her pulse rate is 80 beats per minute. Her respiratory rate is 16 beats per minute and saturation is 99%.
Okay, the tone has regained. So, done a great job, girls. But please keep eye on the patient and maintain a chart, okay, of the
Yes,
vitals, okay?
If the medical line of management fails, we go for surgical line of management. Here, the first thing we are doing is intrauterine balloon tamponading. This can be done through various balloons like Rush balloon, Buckley balloon, Saint-Stacon Blakemore balloon. But these balloons are costly. So we can use our own tamponade using a Foley's catheter and a condom. If balloon tamponading also fails, then we have to prepare the patient for laparotomy and the patient should be shifted to operation theatre. Throughout the process of management of postpartum hemorrhage, documentation and debriefing the patient and the relatives is very important. In the operation theatre, there are steps to be followed. Firstly, we can apply certain sutures on the uterus. These can be Belin suture, Heyman suture. If this doesn't work out, then we go for stepwise devascularization of the uterus, where we ligate the uterine arteries first, then the utero-ovarian anastomosis, and at last anterior division of internal iliac artery. If everything fails, then the last resort is hysterectomy, that is, removal of the uterus. Postpartum hemorrhage is an obstetrician's nightmare. Stitch in time can save 9. Thus, a multidisciplinary team approach and timely management can save so many young lives. Hope this video was helpful. Thanks. Have a great day.